please. So here's the objectives for the session. Basically what we're going to do is share with you the key findings that we've had or we've pulled from inspections for the past 6 months, from about October 2020 to the end of March 2021. We know that everybody out there is tired and you've really had a hard year and a half. But again, we're really grateful and thankful for the work that everybody's done right across the sector. And we've really had a think about what we call these sessions, and what we've went for is we're calling it the right choice for the right reason at the right time, and this will be really apparent when we talk later on about some of the requirements we're finding, and as we're moving through this real period of change, and as we continue to move towards the business as usual, you really need to adapt the guidance, and there's a wee bit of interpretation required because each service will function slightly differently, and also there'll be different local issues that will be affecting how you deliver your service. So again, it's really just, we're going to share with you, like I said, what we found, and then where to go and get help should you need it around guidance, or what supports are available to you. We also know there's some really great practice happening out there, so this isn't all about us just saying, oh, here's the requirements, so here's a summary of the key findings, but that is what the session is really to focus on. And it's really what we've picked up on via our scrutiny, assurance and services during inspections. So again, for us, it's about keeping these things as we're working through the session or the webinar in mind, and actually asking yourself, could this be my service? Because you've got to remember what we're sharing with you is really came from services that are already deemed higher risk. So again, it's just keeping that at the front of your mind. It's not a reflection of every service in the sector. Obviously, it's just a real sample, bearing in mind that we've really only been focusing on higher risk services. Next slide, please. So what we've got here is, and I like to use figures. If anybody who's come into contact with me before, I tend to put things into context. So what we've got here is you have to keep this in mind. We're in a totally different place where we were last October to March, where we've moved on a lot. There's been new guidance, but it's really important not to forget what the learnings have been in the past. So as you can see there, the graphs are just highlighting to you what the demographics are in relation to the COVID spread. So you'll hear us talking about things like, keeping an eye on what's happening locally, because that will again affect how your service is delivered and the practice within it. But like I said, these are just the key figures. It's not the be all and end all. It's just something that we don't want you to let complacency creep in. As we move towards a sort of more business as usual. Let's not forget COVID is still here and it'll be with us, for a long time to come yet. So it's really important that we still keep our focus on reducing risk and reducing spread. Next slide, please. So the high level findings that we've actually came across, and these again are taken from, like I said, the inspections between October and March, October 2020 and March. So what you've got here is, what we're asking you to do is, like I said earlier, is could any of these issues be present in your service? So if you've not had an inspection yet, or I know the inspectors been undertaking other regulatory and scrutiny approaches, but again, these are the kind of things that you need to think about. We're going to be we've picked up on about monitoring people's needs and addressing concerns. We've picked up issues around medication recording. Infection prevention, as you can imagine, has featured quite a lot during the last 6 months, and we are picked up a lot then, and we're still picking up similar issues now. A lot of it hinges around training and competence and making sure staff are keeping up to date. A lot of it's around the safe, clean and well-maintained environment and equipment. So the safe environment cleaning schedules will hopefully help you with that, as well as the care home IPC manual when it becomes into play. And you'll hear more about that from Lorraine in a minute when we're talking about, what's currently in use, and bearing in mind that we're still in a pandemic situation. It hasn't been declared over yet, so we're still using the addendum. Storage and appropriate use of PPE, hand washing facilities. Am I back, Stephen? Yeah?
Yeah, you're back. You just broke up there for a minute, Jackie.
Am I back?
Yep.
Thank you. I just lost it there for a minute. Sorry. So we're talking about storage and appropriate use of PPE, hand washing facilities, waste management, and we're also going to be speaking about quality assurance and staffing levels. Now, again, the background to these is it's from requirements made October to April, and like I said, we're still picking up on some similar issues. Lorraine will be able to give you more information as she works through her slides and a bit more background, and she'll also give you some live examples. So without further ado, I'm going to hand over to Lorraine McDonald. Next slide, please.
Afternoon, folks. My name is Lorraine McDonald, as Jackie said. I was redeployed to the COVID team. I am an inspector and I'll be heading back to the inspection team very shortly, actually, when the COVID team comes to an end. Next slide, please. Okay. The first two slides I want to take you through are regarding quality indicator 7.1, which is about people's health and well-being and people being supported and safeguarded during the COVID pandemic. First thing we picked up was on the monitoring of people's health needs, healthcare needs, and addressing concerns identified. The issues that were picked up were around nutrition, hydration, skin integrity, mobility, stress and distress. Although a number of these concerns were as a direct impact to people developing COVID, there were a significant number were as an indirect consequence of COVID. So we're speaking about where there'd been changes in the service delivery. A significant number were related to physical isolation. You know, we went through that period where people were really in lockdown and a number of residents spent a long time in their bedrooms, and that had a major impact on people's health, well-being, and that was all compounded by the lack of contact with friends and families as well. That did nothing for people's well-beings, and I'm sure you'll agree with me with that. Care home staff have been key to ensuring that people receive the right care at the right time, and your assessment skills have been crucial. However, what we found was that where a problem or need was identified was great, but where there were times where the follow-up actions required to address these problems or needs were lacking. Therefore, it's important that the plan of care that's in place is implemented fully. And where there's a refusal of care or the care is not given as planned, this should be escalated appropriately so that people can be reviewed and action taken quickly to prevent further deterioration, or their plans updated and better or improved care or more person-centred care is put in place. Staff need to be taking every opportunity while assisting somebody with their care to take a look at the whole picture to determine whether or not the planned care is being effective or not, and if it's not, we need to start again and we need to maybe get professional help in. That's basically where things have gone wrong, where people have, for example, carers have just been focused on one task and not picking up another area of care that's been addressed. So, for example, nutrition. Their meals are being delivered to their rooms. Bearing in mind this was over a 6-month period, and things are moving on as we're getting the guidance is relaxing and such like. But the meals were then being taken out. Communication wasn't good, so people continue to lose weight. Therefore, it's important we have a whole team approach to ensure consistent practice and that everybody understands what they're aiming to do or trying to achieve for that specific person. Now, there's a host of good practice information out there, and all of it can be found in our hub. So have a look on there and you'll find all the good practice information on there. Next slide, please, Lindsay. Most of the examples of requirements that were picked up are roundabout COVID related, but this is one about medication recording that our findings were not specifically related to COVID. The concerns that we came across were around the administration and recording of medication. Now, there's lots of good practice guidance out there to support staff with best practice. That includes the NMC Code of Conduct, the professional guidance on the administration of medication in healthcare settings, and the NICE guidance on the management of medication in care homes. We also found issues around about the use of covert medication, particularly for the use of stress and distress. And as you're fully aware, there is guidance out there on the use of covert medication. Concern specifically relating to the pandemic was the use of repurposing of medication, and that guidance remains in place and will do so up until its review in April 2022. Consideration needs to be given to staff training, competency, your quality assurance processes of the whole medication management process. Now, there's lots of good examples out there of improvement projects that have taken place prior to the pandemic, but they're all a good source of information to try and get you on the right track and moving forward to, as Jackie says, this is not a case of trying to tell you you're doing wrong. What we're trying to do is light that spark to say, could this be happening in my home? And if it does, then how can I change that practice? How can I improve the outcomes for people? Next slide, please. Next slide. No. Stephen,
just a bit of a delay there.
Okay, no problem. Thank you. Sorry, I thought I'd lost connection there, folks.
Oh,
Technology and me. The next section we're going to speak about is about quality indicator 7.2. And this relates to infection prevention control practices and supporting a safe environment for people experiencing care and support. Now, as you can imagine, given what our focus has been since the start of the pandemic, by far the most requirements were made in relation to infection prevention control. You'll all be aware that the new Care Home Infection Prevention Control Manual and cleaning specifications were launched in May of this year. Now they're mandatory, although we're not taking them into account until the 1st of September, which is just a week up to now. The addendums, you'll have heard that, you'll know them inside out by now. The addendums continue to apply as long as we're in the pandemic. So although we're not going to be taking the Care Home Manual into account, we're still going to be looking at the addendum, simply because until the Scottish Government tells us otherwise, we still remain in a pandemic. Now, with the implementation of the manual and cleaning specifications, I know that there's a number of services out there who vary slightly from the traditional care homes. Okay, we've got care homes up to 120 beds, but also care homes that have 4 people in them. So as you can imagine, there's a huge breadth of practice out there. We're going to be adopting a proportionate approach, and we'll look at each service individually. And if there's any discrepancies arise, we'll discuss them on an individual basis as they arise. It's important the services have an enablement function, and we don't want to lose that at all. However, it's as equally important that we implement the manual and we look at ways in how the manager or the provider do that, and it's your responsibility to ensure that happens. I'm sure you'll find a way to enable this guidance into practice, into everyday practice, the same way that you've embedded other legislations, for example, fire safety, food safety, and the COSH. Now, the areas we picked up about infection prevention control training where the staff were not completing the training, and that was specifically in relation to e-learning training. The training was ineffective. That is, that maybe staff had done the e-learning training, but they weren't competent in infection prevention control, or they weren't actually putting what they learned into practice. Staff were unaware of the IPC guidance, so they didn't know when we chatted to them about the addendum, about information guidance in care home settings for adults and older people. Other things that we picked up were quite specific, and they were in relation to PPE, the cleaning of equipment and environment, hand hygiene, management of waste and laundry. And as we continue to move through the relaxation of restrictions, the use of PPE at the right time is crucial to prevent the spread of infection. This is not the time to be complacent. Although testing and vaccination are now becoming embedded, COVID is not going away, it's still there. And now is the time for staff to actually be extra vigilant about the whole thing. Now there's lots of information and helpful information about training out there, and training courses and events and just online stuff that's taking place for you and your staff. I'm going to direct you to the TURAS website, that's the NHS website, SSC website, and obviously the Care Inspectorate Hub. Now we've shared some links with you at the end of the webinar for you to click into, and that'll give you direct links into them. Next slide, please. Right. Safe, clean and well-maintained environment and equipment. This comes in two parts when we speak about the equipment and we'll speak about the environment. But the principle throughout this is things should be clean and well-maintained. The Care Home Infection Prevention Control Manual in section 5 speaks about everyday cleaning, and that's for a non-pandemic situation. All right, but remember, we are still in the pandemic situation at the moment. It also speaks about the types of equipment that we should be cleaning, and we should always be following manufacturers' guidance for all equipment, so to make sure you're using the right product in the right dosage for the right length of time for cleaning or decontamination. Type of equipment out there, and you'll see these labels all over the place because single-use equipment, okay, and that's to be a piece of equipment that's used for one resident and then discarded. This is a piece of equipment that must never be reused, even on the same resident. So we're speaking here about syringes, needles, anything like that. Use it once in the bin and away. We've got single individual use, and this is a piece of equipment that can be used by the same resident a number of times as long as it's been decontaminated in between times. So here we're speaking about, for example, a nebulizer that belongs to one person. We're cleaning the mask after use and they're going to use it again. And then we've got the reusable non-invasive equipment, often referred to as communal equipment, and that's where more than one resident is going to be using that. So we're speaking here about commodes, we're speaking about moving and handling equipment, bath hoists, shower chairs, that kind of stuff. Now the manual specifically contains a chapter on the safe management of the care equipment, and this includes links to the National Cleaning Schedule guidance. Now all this guidance it just gives us a nice framework for everybody to be assured they're doing the right thing at the right time, okay, especially for cleaning equipment and the environment. It includes a structure or a plan of cleaning, it includes cleaning templates, it includes standard operating procedures to follow, and also a process for checking to make sure things are done right. So that's just your audits to be undertaken. It's just a nice way to group everything together to make sure everybody's doing the right thing, the right time, using the right products, the right equipment. There are a number of questions that keep coming through to the COVID line, and it's a bit of a concern for yourselves when this comes up, and they're around the use of chlorine releasing agents. The statement we've got for our high is that when an organisation adapts different practice to those recommended by the national guidance, it's organisation's responsibility to ensure safe working systems are in place. That includes the completion of a risk assessment, which is approved through the local governance procedures and measurements are in place. You remember, what was that, about a month ago, the guidance changed to say that chlorine releasing agents should be used for high touch areas or frequently touched areas for high risk pathways, and for medium risk pathways you start to use what's actually in the infection control manual and use only chlorine releasing agents for sanitary wear. So again, it's worth thinking about that and making sure you're using the right product for your service at the right time. Okay. We've also had some discussion around the use of spray bottles, and I know this has given a lot of people a lot of headaches. The guidance from RHI is that reusable detergent, disinfectant spray bottles should not be used should not be reused. Okay, cleaning products that already come in non-refillable spray bottles are fine to use as long as they conform to the BS standards. We're waiting for the literature review to come out for this, and as soon as we have it, we'll pass that on to it. But the main concern is not the washing of the bottle itself, it's the washing of the spray nozzle, and that, particularly that metal spring that's inside it. And the concern is about the colonization of that spring and the mechanism of other bugs. They're not necessarily COVID related, because we've had a long discussion about, well, if you put in chlorine releasing agents, surely that should clean the spring, but it's other things like Pseudomonas and that start to gather in there. So if we're going over to business as usual and moving away about, although COVID's still there, but think about all the other bugs that are out there, then we don't want to be spraying other bugs about the place either. So just to consider that. Next slide, please. Another thing that was picked up was the storage and access to PPE. Okay, questions around where do I store my PPE? How do I store my PPE? The important thing is that staff wear the right PPE at the right time and that they're wearing it properly, but also that's very easily accessible for staff. So we're not having staff to go through 3 doors to be able to get to the PPE that they need. PPE should be stored. How you store it is up to yourself, basically, but it should be stored in a way that helps prevent it from getting damaged or being ineffective. And by that we mean, can other residents get in amongst it? Are they going to be tampering with it? Is it potentially for it to be wet? So that's why we'd say don't keep it in a sluice, because it should be a clean, dry place, but it has to be easily accessible for people. Next slide, please. Oh, the use of PPE. You know, face masks are going to be with us for some time, as well physical distancing in some form. So it's important that we get this right. We need to wear the right PPE at the right time, and we need to make sure that we're wearing it properly. PPE helps reduce the risk, along with the other mitigating factors that we put in place, but helps reduce the risk of spread of any virus, bug that's out there. We're picking up some poor practice, and the poor practice that we're picking up is around donning and doffing. Now, at the start of the pandemic, staff were so good at this, it was drilled into them, but it still remains vital that we do it properly. It all comes back to the training and the quality assurance systems that are in place. Some of our other findings are in relation to fluid-resistant surgical masks either not being worn or not being worn appropriately. A number of carers think that because they've had the vaccine, because they're being tested regularly, then it's fine, I don't need to bother with a mask. That, as we know, is sadly not the case. We need to continue to wear a fluid-resistant surgical mask. We've seen masks in the most strangest places, under the chin, keeping your chin nice and warm, tucked over one ear and hanging down, under your nose, you know, a big nose poking out from it. But it's a complacency we don't want to see creeping in. It should still be high on our list of priorities, that if we have to wear face masks, then we should wear them properly. Quality assurance systems are vital at keeping everybody focused on reducing the risks. Gloves are another area. People using the wrong gloves for the wrong task. We're still seeing some vinyl gloves out there being used for personal care. Vinyl gloves have got a specific use, but we should be using nitrile gloves when we're dealing with any kind of body product. And as you know, there's an Appendix 5 in the Infection Prevention Control Manual, gives you a lovely flow chart to tell you what gloves you should be using, when you should be using them. Staff are becoming complacent and careless at times, and that's one of the big things that we picked up. I think because nobody's watching them, then I don't need that anymore. But as you all know out there, that COVID's still a big risk of the virus spreading. Although we might not be seeing so many people in hospital, the virus is still there and the numbers are increasing significantly. Next slide, please. Hand washing facilities. This was a big issue in a number of services, simply because we were looking at things we hadn't necessarily looked at before. The legislation is clear that we should have sufficient numbers of wash hand basins for the task at hand. However, it does not say how many basins we need. The Better Building Guidance, okay, which has just had a recent consultation and for the new guidance, and it closed in July, says that wash hand basins should be readily available and convenient for use. So therefore, the issues that we've been picking up have been around no hand washing facilities in specific areas, so such as dirty utility rooms, sluices, DSR rooms, your domestic rooms, your medication rooms, your treatment rooms, and your laundry area. For staff, if they haven't got direct access to a wash hand basin to wash their hands properly, the use of alcohol gel is quite appropriate, but it can only be used where hands are visibly clean. So we would be strongly encouraging people to wash their hands properly with liquid soap and running water at the first opportunity. But if you can't get a basin, then obviously hand gel there. Next slide, please. Management of waste products. The biggest risk is we don't always know where the risk is for COVID-19. So it's important that you're clear as to how your waste, the waste that is generated, is disposed of as part of your caring duties. Waste for the mid and the medium risk categories should be managed now in your normal waste stream. So you no longer need to hold it for 72 hours as we did a good couple of months ago. Now there's a whole section out there about how waste should be handled within the Infection Prevention Control Manual. It's in section 1.9, okay, but things to consider are we need to think about the locations of our bins internally. Are they readily accessible for people when they go to take off their PPE? How far do they need to go with the PPE to put it in a bin? Do they need to go through 3 doors, and is that appropriate? Externally, we need to think about the security of our bins and the storage. If you have to retain your waste for 72 hours, where are you going to store that? Hopefully, we're not going to get to the point, as in the picture in the top right hand side of the picture there. All bins should be lidded and foot operated. We don't want anybody touching bins to put waste away. If you have got a contract in place with waste management company, should be using the correct color coded bags, and they should be tagged properly. And the capacity, think of the capacity of how you're filling these bags. They should be overflowing. They should be 3/4 full as a maximum there. Next slide, please. Oh, bear with me, I turned over a page too much there. You almost had a spiel that wasn't on the screen. Okay, the quality assurance processes and your quality assurance regarding infection prevention control, cleaning and of equipment here. Now you'll have your own quality assurance processes or systems in place, but are they doing what they say on the tin, or are they improving outcomes, or are they just checklists? We've got a wee scenario here. Okay, you've got a sluice. Your sluice is untidy, it's cluttered with equipment, it's got PPE in it, it smells, and staff can't access the wash hand basin. Your audits continually show up a shortfall around the cleanliness. Okay, so what are you going to do about it? It sounds simple, but making sustainable improvements can be challenging, which I'm sure half of you are aware of. It's all down to human factors and reviewing practice, as well as systems and processes. Remember, people drive this infection forward, so you can have all the systems in the world, but if people aren't following them, we're not going to get further forward. The whole point of a quality assurance system is to determine whether you are meeting an agreed standard. And where you're not, the method of improvement is one way to help you determine why not. It should help you generate ideas on what you could do to improve. It should give you tools to review what you do and how you do it, and then how to plan the next step. That's what we call the PDSA cycle, the plan, act, study, do cycle. Or plan, do, study, act cycle, sorry, got back to front there. Now it has to be a whole team approach, and this is where generate your improvement plan. So if you're going to undertake a quality assurance around the cleanliness of the sluice, for example, what would you do? You're going to monitor and check, observation practice, spot checks, feedback to identify any issues. Involve the whole team in coming up with ideas and improvements. It could be something simple. For example, it's clutter because there's no place else to put the commodes, or, oh, I never thought to store the PPE someplace else. Or the fan's not working, hence the smell. You put ideas into practice, then you monitor the effect of them. The next step would be to review the any positive or negative impact. Changes in approach and review all over again. Keep that circle going. Staff generally know the needs, what needs to be improved, but they need support to get there, need to discuss with staff. It's an ongoing assessment. Observational assessment is vital. Okay, so have a look at your quality assurance systems. Do they do what it says on the tin, or is it just a checklist that you're actually using there? Next slide, please. And my final slide comes from the 7.3, which is around staffing arrangements and are they responsive to people's changing needs. It's not just about the number of direct care staff. We need to consider things like domestics and auxiliary staff, and they're very key in making sure that people's welfare needs are being met. And this is becoming even more important as we start to implement the safe environment and cleaning schedules. So we need to think about the domestic staff, or if you haven't got domestic staff, is there enough care staff to ensure that they can undertake the role of to ensure the place is clean as well? It's being flexible and it's making sure that something doesn't suffer, and who we don't want to suffer is the people that we're delivering the care to. As you know, there's work ongoing just now with our Safe Staffing project, and there's links to that within our website in relation to that, and that came about with the Royal Assent of the Act in 2019. There's lots of good information ongoing about that at the moment. I'm going to pass you back to Jackie. Next slide, please, who's going to take presentation on further. Thank you.
Thanks, Lorraine. I know that probably sounded like, oh, why are you even talking about this? But these are the things, like we've said at the beginning, that we're picking up on. And some of the things, you know, it might be worth revisiting within your own service around, you know, the systems and processes that you've got, or just going back and having a look at staff practice, or, you know, maybe even run a refresher on an IPC if that's appropriate. So again, it's not about telling you how to suck eggs, and I hope that's not what we've came across as, but we just thought it'd be really useful to take this time just to share with you, like I said, the high level findings that we have picked up during our scrutiny and assurance practice. You know, bearing in mind that we're in a different place now, but that's not to say we're still not picking up some of these things. And it, like I said, as inspectors start to go out, you know, it'd be really good if you know, you've had a look at the things that we've talked about today, just to make sure you're comfortable and that you have got good practice in place. Next slide, please. So where can you find information that will help you? Well, as Lorraine said earlier, there's a lot out there, but you have to find the right information, and you know you need to know where to go and get it. Like we said earlier, the Care Inspectorate Hub, we have a frequently asked questions page that the COVID team is currently updating and prep for the stand down of the Care Inspectorate COVID team. Oh, goodness. Okay, so there before I get wiped out again. The COVID team is currently updating our frequently asked questions in the compendium. So as part of the COVID team step down of the care inspectorate's frontline team that was really keeping an eye on the guidance, we're updating all these things, and we will put them on the web page. So if you're looking for anything, that would be a good place to start, because we've hyperlinked everything to either TURAS, the Scottish Government, Public Health Scotland. So all the links are in there, and with some of the key questions that we've been getting asked at the COVID team. So again, if you've got something around PPE, or you've got something around, you know, staff training or the environment, if you go in there, you'll probably see a frequently asked question in it, and then the link will take you to where that guidance is that will help you. We also are obviously promoting the cleaning, the safe environment cleaning schedules, because again, although we're not out the pandemic yet, and somebody's put a question in the chat around it, they really are a good basis for organising your service, and depending on what risk pathway you're on, then you could up the cleaning based on, you know, the addendum as well. So you've got a really good baseline cleaning, but then you've got this enhanced cleaning going on as well, if there happens to be a reason for doing that. And obviously the National Infection Prevention Control Manual, again, has all these fantastic links within it that will take you to the relevant pages based on the various sections that are within it. So again, even though we're not using that manual at the minute, it's still a really good resource to get access to some fantastic information that can help you with most things. And it's really useful. I know you've been given a 3-month lead-in time, but it's really useful just to, you know, I know you've been doing it, and I know a lot of services have, they've been running sessions. Just when the pandemic is declared over, then there'll be a smooth sort of transition into using the manual and away from the addendum. So, like I said, if you use the Public Health Scotland website, the Care Inspectorate website, and the links that I'll show you at the end for Scottish Government, that pretty much covers all your bases. But you might have other sites that you like to use as well, but that is where the core information will be kept. And you'll probably see in the chat folk asking about, you know, updated guidance. These are the places where you'll find it first. And we are aware that some of the guidance, especially from Public Health Scotland, is under review at the minute. So that is the place I would be using most days. I tend to check in most days in these sites, and I know you don't always have that time, but it's useful just to get into the habit, especially as we're moving out, or we're moving to this business as usual approach now, where the guidance is changing just as quickly probably as when the pandemic kicked off. Coming out at the other end, the guidance is changing quite rapidly as well, you know, based on the evidence that's been presented. Next slide, please. So that's the summary of useful resources there. You've all got a copy of these slides, and again, the links are all active, so we tend to hyperlink to everything so that when the document is updated, you're always working to the most up-to-date information. If you decide to download it, then it's really out of date the minute you've downloaded it. So it's really useful to get into the habit of, even if you have downloaded it, the guidance or whatever, that you go back and check to make sure you're still using the most up-to-date information. Next slide, please. So these are your take-home messages. The IPC addendum will stay in play until the pandemic is declared over. There'll be a natural transfer to the care home IPC manual when the pandemic is declared over. So again, it's really useful, like we're talking about, just to get, you know, use that. There's lots of really good information within it. So, and as you'll see in the chat, some people have been asking you know, there should be this natural transition because you're kind of running two at the minute, although you might not be applying one. But even at the minute, when we come out of this, you have to be outbreak ready. So again, the Public Health Scotland's got a really good outbreak checklist, and if you don't know about it, please go on and have a look. You might have been one of the services that have never had an outbreak, but that's not to say that you don't, you know, you don't get yourself ready, because COVID is still out there. And if you look back to the slide that I showed you around the sort of transmission or the age range, if you look at that age range, it's nearly all the age ranges of staff who are out there working in the field. And as their lives are getting back to normal and becoming into more contact with the best will in the world, you just, you know, you just need to be prepared. And it's also about preventing complacency creeping in. Like Lorraine said earlier, it's all about human factors. It's about making sure people have access to the right equipment at the right time and the right amount, you know, so that they can actually do the right thing. So please keep on and keep reviewing and using your quality assurance systems to make sure you've got all these systems and processes in place. And even as we're moving through back to a business as usual model, that we actually are keeping an eye on, you know, what's actually happening. And I'm sure you are, but it's just, again, it's so easy just to sort of start to relax a wee bit, but this is not the time to be doing that. It's also important that you use the kind of figures that we showed earlier. Just know what's happening locally, again, about, you know, what is the spread within the local area that the service is based in. Again, that might change your approach within the service around, you know, maybe revisiting some education sessions for the staff just to make sure that they're kept on point, or you might want to up your quality assurance input so that, again, you're making sure that staff are doing what they should be doing. And it's not just about, you know, Big Brother and watching everything, it's about just reinforcing those really key messages to reduce the likelihood of spread. And like we said earlier, the safe environment and the cleaning schedules, you know, these are really another really good document that will help, not just to sort of when we're at the pandemic, but it's got some really good, useful baseline cleaning that really should be in place anyway. And then you would enhance that if you you'd go at your outbreak checklist and then put all your other cleaning measures in place. So again, just remember to use the guidance that we're highlighting to you to make the right choice at the right time for the right reason. Next slide, please. So that's basically it. It's been a wee whirl stop sort of covering the high level things that we've picked up at inspection. I hope you found it useful. I hope it will help maybe to refocus if you've never had a site visit from the inspection teams. You know, please go back to your services and use this, because again, the IPC stuff from Key Question 7, as you know, the quality framework has been reviewed. They've combined both older people and adults, and all through that we've kind of been threading the IPC. So the inspectors will continue to look for that. I'll continue to look for that when I come into services, as will my colleagues. So it's really important, like I said, just not to get complacent, and I can't stress that enough. It's just really important that we stay focused, because COVID is still there, as well as all these other things that are going to be coming over the winter. So again, it doesn't do any harm just to keep revisiting stuff and re-educating staff, or just getting over things.
Jackie, I see there's been a few questions in the Q&A chat, but they've been replied to by yourself and Lorraine using the chat. So I wonder if we just want to give a minute for any other questions to come in, if anyone wants to type those into the chat now.
That would be super, thank you. I get lost there again, Stephen. I don't know what's happening at my end today. It's been a bit hit or miss.
Yeah, there's been a couple of connection problems, it seems, but hopefully most of it's come through.
Does anybody get any final questions? You can see in the chat some of them around using the addendum versus the care home manual. Others are around, you know, how do you escalate concerns when you pick them up around health and well-being.
And just to say, I was just going to say there, Jackie, just a reminder to everyone that we'll be sending out a link to this video as well as the presentation slides in a few days' time, just in case you feel you missed anything or wanted to follow anything up.
Thank you, Stephen. The evaluation, Stephen, where will they get the link for that, just so that we can improve?
Yeah, I'm just going to paste a link to this evaluation form in the chat now. If people could please fill this in if you can now. If not, don't worry, we'll include it in this email that we're going to send to you with the other links.
If there's nothing else, then you can get 15 minutes of your life back, and I hope that you find it useful. But please fill in the evaluation forms. We really welcome your feedback, because we're always looking to improve how we present things, and did we hit the mark or not. So we look forward to receiving that. So thank you very much for your time, and have a good afternoon.
Thanks, everyone. I'll just leave it up for a minute if you want to complete that form. And as I say, we'll send you out an email, and any questions, just get back to us.